excited to have you all here. I'll give you a little bit of history about the B Foundation, and then also you found on your seats a pamphlet about who we are and some statistics about brain aneurysms, and then also our newly developed EMT and first responder card for brain aneurysm ruptures. The B Foundation was founded 10 years ago. We are committed to raising awareness and funding research, advocating on Capitol Hill, as well as providing support to all people affected by brain aneurysms. We are passionate about believing that this disease can be prevented and that we can save lives. As some of you may not know, 1 in 50 people have a brain aneurysm. That's 6.7 million people in the U.S. They rupture every 18 minutes, and about 50% of ruptures end in death. And probably the most unknown statistic is that most ruptures happen between the ages of 35 and 60. So this is a disease that can affect people of all ages. It is a hemorrhagic stroke, and it is very commonly younger people, which is a misconception in the public. And so we're here today for a few different reasons, to spread awareness, but also we have some great speakers who will talk more about best practices and education for the first responder community and helping getting more and more people to the right facilities at time of rupture. And I'm going to turn it over to Christine to tell you a little bit more about best practices and the work that and progress we've made on Capitol Hill.
So thank you again. So in our case of where we started, for those that don't know, we lost my cousin Jennifer Sedney on Christmas Day 10 years ago. Everything that could go wrong in our case went wrong. And that's why we're here today, and what we're doing on the Hill is to combat that EMS, best practices, EMT of what to do. So from the primary care, from the GP, from the FP, really working with them. And what we've been on the Hill for almost 10 years, we're represented by Arnold & Porter, which is down in Mass Ave, which is one of the top healthcare lobby firms, and they represent us pro bono, but we work on a number of different things. But as Erin said, one of the things is on best practices, talking about when the EMS arrives, what do we do from there, where to transport of that patient, of that person, and so that is something that is so key and critical, is we talk about the oxygen, the brain time to transport, all of that. And so that's why we're here to really push it out as a community-driven event, then push it out to the state level, then push it out to the national level to save lives. Erin and I, when we both started this organization, we walked out of the hospital. I knew 5 people. Debbie was the 5th that I knew that had died between the ages of 22 and 38. I did not know a survivor. And that is when I turned and said, we're going to change this, we're going to change the world, I'm done with this. And so that's why we do this every day.
Today we have many brain aneurysm survivors with us. We had a day-long retreat, kind of building connections between our awareness ambassador group, and the goal is they're from all over the country and world, and the goal is to bring awareness education sessions like this to other communities, really just educating the public. You can never underestimate the power of when someone says, I'm having the worst headache of their life, they need to go to the hospital immediately and to a neurologic care hospital. So without further ado, I want to introduce 2 esteemed guests tonight. We have Matt Hepler, who is the stroke care manager for Bryn Mawr Hospital and PLA Hospital with Mainline Health. And then we also have Tracy Faulkner, a TBF Awareness Ambassador and pharmacist and survivor. So welcome, Tracy and Matt.
Thanks, Christina. Hi, good afternoon. So my name is Matt Hepler. I'm the stroke program manager for Bryn Mawr Hospital, and also only for a little bit longer. They just hired me as stroke program manager. So I have some more free time. It's my pleasure to speak with everyone today about some of my experiences, but more importantly, I'd like to introduce you to Tracy Faulkner, who's a pharmacist from Washington, I think you are now, and you were also in rural Virginia. So Tracy is going to share with us her story, and I've had the pleasure of listening to a lot of different aneurysm survivor stories over the past couple months, in addition to, with my work, but being able to speak with some people on a more personal level is something that I'm really grateful for, to have that connection with the B Foundation. I've learned a lot. It's continued to help my practices in the hospital. And I wanted to share, how we're changing some of the treatments, some of the things that are changing in the pre-hospital arena, treatment of aneurysms, and some of the things that we're going to do and continue to do to decrease time to treatment. So I'd like to hear, Tracy, more about your story, and maybe we can use that to discuss in your case, and then we can also hear from the group about other instances. So if you wouldn't mind, we'd love to hear about how we were talking.
And thank you to the Foundation for allowing me this opportunity to share. It was November 13th, 2016. It was 6 days from my birthday. And I was about to go on a business trip. And it was 7:45 in the morning on a Sunday. It was a beautiful sunny day, just like this. And all of a sudden, I felt a pop in my ears, and I felt like I was burning up. So I was burning up all in my face, all down my arms, down my legs. So I knew that something was wrong, but I wasn't quite sure what that was. So I ran to the medicine cabinet and I got aspirin, and I also took Tylenol. And then in the days of iPhones, I was able to use my iPhone to FaceTime a friend. My health POA is actually a physician. So on a Sunday at 8 o'clock in the morning, she actually answered the phone. And I said, I need to know who's on for trauma today, because I just felt this pop in my head and I can't move my neck. I'm seeing double and I don't want to collapse and no one knows what happened to me. So she said, you need to get to the hospital as soon as possible. So what I did was, I ran outside, and again, it was a Sunday morning. I asked a neighbor, I said, I need to ask a favor of you, please. I just need to run to the emergency room. I need to get something checked out. Don't worry about me getting back home. I just need to get a ride to the emergency room. So she said, sure, no problem. So as she was driving, my head is still, I feel like it's gonna pop, like crack open. And so then I said, ma'am, if you don't mind, I kind of got a headache and I'm not really sure what it is. Could you please put on your flashers and get to the hospital? In the meantime, my friend had actually called the hospital ahead of time to let them know that I was coming. By the time I arrived, which was less than 15 minutes, when I got to the emergency room, I was actually vomiting. And when I came in, I just handed the receptionist my ID card and I said, I think my friend called, and then I started vomiting. So they immediately triaged me. First of all, I want to say on a Sunday morning, I don't think I've ever been to an emergency room and it was empty. So the stars were aligned for me on that particular day. So I went in and I grabbed the nasal cannula with oxygen, and I grabbed that and just put it on my head. And then I said, can we just go to the CT scanner? She's like, I need to get your blood pressure. I'm like, ma'am, I don't think you have time for that to get my blood pressure and the CT scanner. So, we hurriedly went down the hallway to radiology, have a CAT scan, and then they took my blood pressure at that time. It was 160 over 100. That was my blood pressure. I was seeing double. I couldn't move my neck. My head was just, I couldn't move it. Then I started moving my hands and feet, and they're like, oh, Miss Faulkner, what are you doing? I'm like, I just want to make sure I'm still alive. Because in my mind, I'm thinking, okay, if I can do this, that means my brain is still connected in some way. I don't really know what's going on with me, but that's what I did. So after being assessed, they did discover that I did have a subarachnoid hemorrhage or a brain bleed. And then from that time on, this was within the hour, I would say before 9 o'clock. The emergency medicine doctor came in and he says, well, I just want to let you know you kind of blew out your brainstem and we got to get you meted back to a critical care center. I said, okay. And he's like, well, I need you to stop talking and stop moving. I said, sir, I can't. I'm scared. I can't relax. So I'm going to keep moving. I just got to keep moving. He said, we kind of need to get you to calm down. I said, sir, I'm sorry, I can't. because I'm here, nobody knows I'm here. I don't know what this is, it's happening to me, and I'm still not making the connection that it's a hemorrhagic stroke. When you hear brain bleed, I've only known of strokes, meaning ischemic strokes with the blood clot. I don't even know I'm having a stroke. I'm like, I don't know what this is happening. So,
How are you feeling at that time?
I was in survival mode because, again, I just asked someone from the neighborhood to just take me to the emergency room. I lived alone at the time. I didn't want to collapse in my house and nobody knew, that I'm there. So I was doing everything to stay alive that I could think of.
Pretty bad head.
Oh, yes.
Yeah.
It was splitting. Like, I felt like my head was going to open, but I was burning up too.
So we talked about brain aneurysm. So, what is a brain aneurysm and why does it hurt when it ruptures? Brain aneurysm is a weakening of the vessel wall, okay? Almost like a balloon. And the bigger the balloon gets, the thinner the wall gets. So if you imagine, everyone can relate, you go into the primary care physician's office, they put a blood pressure cuff on your arm, they start to tighten it, and you get up to about, 150, 160, it starts to really hurt. That's the systolic pressure that you're feeling. That's when the heart is in systolic, when it's squeezing down. So Tracy, your blood pressure is about 170, and normally
160 over 100.
And where do you lie normally?
Less than 120, about 160 over 67. I mean, I was, if I may add, I have a family history of ischemic stroke. My mother actually had a massive stroke at the age of 55. So I was in my first job out of college, living my life, and I get this call that my mother was scheduled to meet some friends for lunch. My mother's an educator during the summer, so she didn't come. So then they called me, and I'm like, that's not like her, because she's very social. So in a situation like that, I had one of her neighbors just go to the house, and then I said, just pull her downstairs. She was in the bed, new, and she had a massive stroke at that time, but she was able to walk. She didn't really know what she was doing, so in that case, they took her to the emergency room as well, and she recovered. So I knew about strokes. I also had a great aunt that had a stroke in the 1980s, and then just said, well, she had a brain bleed, and it was just the area of pons of the brain. Then the next year, it was a few years later, her younger brother had the same type of stroke, and they had that lump syndrome where just the only thing moved their eyes. So I was aware of strokes, but I never made a connection that an aneurysm was a stroke, because I was focused on living my life to prevent myself from becoming or experiencing what my mother did.
So you were aware of these ischemic strokes caused by clots, you had family history,
Right.
but you didn't really think of hemorrhagic strokes and the
No.
connection with the okay, that's really important. Okay. Yeah, interesting. Thank you so much for sharing.
Oh, sure.
So with blood pressure, you have weakening of the vessel wall. And if you think about how tight that blood pressure cuff gets when it's on your arm, if you've ever felt it go to 180, 190, it's not uncommon for these patients to feel that in their head. So what happens is that balloon, the weakening of the vessel wall, that'll rupture, and you've got about 80% tissue in your head. It's a closed cavity, about 10% CSF, and about 10% blood. So the blood has got nowhere to go, and all that pressure, if you were to pop that blood pressure cuff, imagine that that's what's happening to the aneurysm, and the blood is going into a non-expandable cavity, and it hurts. And not only does it hurt, it's excruciating, from what I understand. So now we're on the clock, okay? So we have to recognize that this is a subarachnoid hemorrhage. We have to call 911. The reason I say that is because there's some things that are associated with ruptured brain aneurysms. We find that about 13% of patients have seizures right then and there before they get to the hospital. Some of them lose consciousness completely, and depending on the area of the brain and the bleeding pressing down on that brain, you can lose consciousness completely, but also lose your ventilatory drive. So that's why we were lucky to have some amazing folks in the pre-medicine arena who are equipped to handle that but we need to make sure that they're notified via 911. So what I want to focus on right now, if we look at these cards, the signs and symptoms are on the front, okay? It can be one of these, it can be all of them, but if it's any one of these, we want to call 911. I don't want to understate that at all. You cannot miss this, okay? The mortality is 50%. So we have survivors here, and we're gonna save lives, we're gonna get the word out, but that has to start with calling 911, okay? The reasons that we do that is because they can treat seizures, they can manage airways, and they know what capabilities each facility has, whether they have neurosurgery there, or whether or not they're so unstable that they have to go to the closest facility to get a CAT scan and to get airway management, reversal of anticoagulation. I'll explain that in a minute. So part one, recognition, okay? We as a group are going to spread awareness. We can reach out, we can go to urgent cares, we can go to EMS facilities, we can call hospitals and get a hold of stroke program managers, community health departments, and we can ask if we can speak with them and share literature, because I can guarantee you that this is not given out anywhere in this area, okay? This is something that ischemic strokes, to Tracy's point, it's in the spotlight. People are aware of these things. They know family history, and they're going to report to the hospital, and they're going to say, I think I'm having a stroke. But not this, okay? Now, why is that? It's a small percentage of patients who make it to the hospital, okay? It's about 6% or so of all ischemic strokes that are ruptured from an aneurysm. There's lots of hemorrhagic strokes. But with the mortality rates, when I say we can't miss this, we cannot miss this. We need to make sure that the facilities are aware that we think it's a subarachnoid hemorrhage, get them the CAT scan immediately. So some of the things that we talk to EMS about, when we hand this out, we have signs and symptoms. We have mimics. You'll hear time and time again that people are misdiagnosed. They think possibly it's an overdose. They think it's a migraine. They think that it's, a seizure, even if it's just a seizure. So if we have family history, we can say either they have a known aneurysm or they've got family history of an aneurysm. And as long as we're asking these questions, we can say, we think it's a subarachnoid hemorrhage or it's a brain bleeding. That's going to get them the CAT scan. And from there, they can diagnose exactly what it is. And we can either transport or we can treat at that facility. One of the biggest risks we have with subarachnoid hemorrhage is a rebleed. So we have an aneurysm, and if it bleeds initially, it can what they call tamponade itself, where the blood pressure is actually kind of holding pressure down, and like you have a cut on your arm. That can stop the bleeding temporarily. But with that pressure inside, these are arteries that we're talking about. Okay, this is where you're feeling the pulse, that pressure that we're feeling. It can re-rupture, and that is unfortunately when most people are in the most trouble. So if they're so unstable, and we take patients to a local hospital and they're stabilized, we can manage blood pressures. We have to fly them to a tertiary care center. And there's so much research to say that it's a class 1 recommendation from the AHA that they should be going to facilities that perform endovascular treatments, and they do so often. Class 1 recommendation is the highest recommendation. And I'll talk about a couple of the classes if we get there. But we recognize, and we're going to get that by spreading awareness, right? We can reach out to EMS, PCP offices, urgent care centers. We can give them literature. We can speak to them, because I'm guaranteeing you no one is probably doing this right now, and especially not as good as advocates as we have in this room. We have some of the best experts around, and I deal with physicians all day long. It's not their fault necessarily, but they just may not be aware of how on the radar. So once we get them to facilities, we can stabilize them, and these patients are very unstable just by nature of what's going on. So if they need airway management, we can do that. If we need seizure prophylaxis, we can do that. Another thing that we'd like to talk about is intracranial pressure. Okay, so when we talk about a closed cavity, it's your skull. We've got brain tissue, we've got CSF, we've got blood. If one thing increases, something's got to give. There's nowhere for it to go. The only way actually out is through the spinal cavity, and that's sure enough going to be death at that point. So we don't ever let it get to that point. When I say that we really want to go to a facility that has neurosurgical capabilities, they may not necessarily treat aneurysms. They may do general neurosurgery. The reason that's so important is because they can do an external ventricular drain, and they can relieve the pressure. This can be done in emergency room settings at the bedside and ICUs. Most places that have a neurosurgical capabilities facilities, they'll have somebody on call. They can relieve that pressure, and that will buy us time. We can get into an aircraft and go to the tertiary care facility where we may put a coil in that night, but we may not even need to with the airway management, seizure prophylaxis, hypertension, blood pressure control, and possibly an external ventricular drain if needed. These patients are stable now. We can watch them, we can monitor their ICP, their cranial pressure, and we can get them to the treatment that's going to ultimately be, the lifelong treatment, or at least the temporizing measure until we get to the lifelong treatment. Yeah.
In my case too, I had hydrocephalus. So, because I get you something about ventricular or something.
Yeah.
What does that mean?
Yeah, so we have 4 ventricles in the brain. It's drainage pipes, really.
Mine was congested. It was, yeah, and that's why I had the hydrocephalus. So that explained the brain swelling?
Yeah, so
This brain swelling, and then because my aneurysm was the left superior cellular artery, which innervates the brainstem, which is the command center of the brain, as well as the cerebellum, right, which is balance and all that. I lived alone at the time. I didn't want to collapse in my house if nobody knew that I'm there. So I was doing everything to stay alive that I could think of. Oh, yes. It was splitting, like I felt like my head was bent open, but I was burning up too. I was just burning up all over.
they met to another facility?
Yes, they did.
Did the facility you went to, did that have a neurosurgical service there?
Absolutely. I was went back to a major neurocritical care, ICU, and I arrived from one hospital, the helicopter came to the hospital where I was, and I was back at the main center in 11 minutes. And I was on the helipad, came right and rolled right into the ICU. And as soon as I got into there, they took me to radiology and did more imaging.
Did you ever yourself to the hospital?
Well, I had someone driving me. That's probably not the thing you want.
Yeah, these are all great points. You seem really aware, and you know a lot about medicine from some of your background as physicists, right? So you knew something was wrong, and you needed to get help quickly. You thought about all these things, being outside, being around people. You had someone driving. You called ahead. Which is incredible. And you remember that to your gift. So I just wanted to touch on a little bit of these points that Tracy makes. And no one are better advocates than survivors, in my opinion, because nothing starts home better than hearing it from someone who's experienced it. So we talk about brain aneurysm. So, what is a brain aneurysm, and why does it hurt when it ruptures? Brain aneurysm is a weakening of the vessel wall. When we're talking to facilities, to urgent cares, to EMS facilities, there are some things that we can recommend. We're not always lucky enough to have such robust EMS pre-hospital services right around the corner with neurointerventional sites right there as well. There are some things that are going to make sense and they're easy to tell people. Okay, recognition of symptoms, of course, knowing where we have neurosurgery, knowing where we have CAT scans. That's pretty easy. But what about the patients that are complaining of the symptoms on the front of the card? The worst headache of life, the wind top headache, maybe they have family history. We can tell EMS that they can put the head in the bed 30 degrees or above, and that's on the card as well. What that does, it's going to promote drainage. Gravity's going to be your friend there, so it's going to drain CSF, it's going to decrease ICP, intracranial pressure, so it's going to make it easier for the brain to survive with all that extra pressure in the cavity. So we, oh yeah.
In the spectrum, well, in the hospital, in the ER, the bed was elevated and even going to the helicopter. I have a fear of brain fire.
Other things I'd ask you, how excruciating pain was.
It felt like sandpaper. It just felt like sandpaper, just all everywhere. It was so it just felt like somebody's just taking a piece of sandpaper and just scraping and scraping and scraping and scraping, and it doesn't go away, and then across my face too. That's how I felt.
So all that pain, what does that do? That increases intracranial pressure, okay? You're gonna drive your blood pressure up and you're gonna worsen the bleed. So paramedics, they can give pain medications and they can decrease pain, in turn decreasing SCP, okay? They can also prophylactically treat seizures or treat active seizures with benzodiazepines, different medications that they carry routinely. So if a patient does have a seizure, they can treat it right then and there. There's also a lot of photophobia. I understand, I see that in some patients, not all, but just the light sensitivity is excruciating as well. So they can decrease the lights, they can treat pain, they can manage seizures, and if the patient gets sick enough, they can manage the airway as well. So the first call goes to 911. If they're so unstable, we tell them to go to the closest facility. If they're somewhere in the middle here on this card where they've got the worst headache of life, but they're not unstable, and there's equidistant facilities, for instance, on Mainline Health, we have Riddle Hospital not too far away. They don't have neurosurgery, okay? We can get them there. But if they're equidistant, we recommend that they go to the neurosurgical capable facility, okay? So they can do temporizing measures if needed, such as the drain, the external ventricular drains, okay? Once the patient's admitted to the hospital, we talk about different things that we can do. We're not going to get into treatment so much, but I can tell you that every single month, there's new research, there's new technology. We're treating patients overnight and they're able to go home electively for some of these aneurysms. But in the emergency setting, we're going to watch them for about 21 days at least. Okay? We talk about some of the constriction of the vessels. We're able to dilate that, make sure the bleeding stops, circulation continues ultimately. So I wanted to hear a little bit from the crowd. So who do we have here that's a survivor? Wow. So, amazing. Wow. This.
Also, in addition, when I was in the ICU, the neurosurgeon stands over me. He says, "Well, Ms. Faulkner, we have good news and we have bad news." I said, "Well, the bad news is I have a stroke, aneurysm." He's like, "Yeah." I was like, "So what's good?" He's like, "Well, it's good that you're alive. You can talk to me. We have this conversation." The other thing is, not only have you had a brain aneurysm rupture, you have 2 unruptures. So I said, "Okay, well, I'm here, so can you fix it?" He's like, "Not so fast, not so fast." So not only did I have a ruptured brain aneurysm, I had 2 unruptures at the same time. So had I not had that rupture, first of all, I didn't even know I had them, but then I had 2, so then it was extra vigilance for me because the other 2 could rupture at any time.
And that's scary.
Yes, it is.
Having unruptured aneurysm. Also, there's a lot that goes into that. And so with this incredible group that we have of experts, I want to see what I'm missing, and I want to see what questions or stories that the group would like to share so we can discuss.
Well, I don't, everything that y'all, I think my own, I think my only question is, I know that we're saying as advocates and ambassadors, we want to go out and speak to like emergency room, like 911 person at quarters, guys.
We got you, Joyce.
But if their training happening at the highest level, like, how do we ensure that when you're training or however many times you have to go back for training like this, it comes up? Because I think, when I think about this, I get really frustrated.
I'm sure.
Because my guy came, when I say my guy, the emergency. What do they call it? EMS came, thank you. EMS came, they see that something's wrong, and they say to me, "Oh, you work a really hard job, you're probably just stressed." And then, so for an hour, 2 hours, I was sitting with the bleed just happening. Of course, the swelling happened. piece of my skull is gone. I mean, it's back in, I think. I don't really know how it happens, but what can we make sure is happening at the highest level? You know, these people are going to get these trainings, or every time they go for update, yes, because this is not coming up. And so had my person, I don't even want to call them, had the person gotten into the hospital without now, would I be able to walk?
Right.
Like, with these things, would everything have been as bad as it is had I gone to the hospital sooner? Because the more your brain swells, the more you struggle with things, right? Yeah. And so if he had taken me to the hospital at that moment, maybe I'd be able to walk or something. And so the question is, what can happen at the highest level when these people are going to get trained to support people with AIDS?
Yes. So thank you. Appreciate it. It's a wonderful question. I would just like to say, the B Foundation is an organization that's really driven me to become more involved with this specifically. So the work that everyone's doing, I think, is the highlight, of that question when they're lobbying in DC. But is it enough? So the events like this is definitely in the right direction. For the AHA, American Heart Association, in 2023, they came out with new aneurysmal rupture recommendations. It's good that they're doing these updates. It's good that there's a lot of research going into it. But I'll tell you, it's almost all based in the acute setting in the hospital and the care in the critical care departments. And I can't find much to do with the hospital or how they're going to address lack of education or awareness. So I think that we continue spreading awareness. We talk to people. I'm going to continue to work as hard as I can, and I'm just glad to be a part, of an amazing group like this. There needs to be more.
I can just add so the work that we do, as you mentioned, is top down with policy on Capitol Hill, with HHS, with CDC, in developing those best practices for emergency technicians. But unfortunately, we also have to do the bottom up, what we're doing right here. We have to start small with grassroots efforts, and it's going to save it for the end, but it's you taking these pamphlets, walking into your fire stations. It's the police officers and firemen that we have here telling their colleagues, and it's doing that grassroots work. And it is enough. It's not enough, but it is powerful, and it does make a difference, and it will save a life one by one. And that's why we're here. That's why all of you all are here. And that this card that we've developed, Matt can share, the EMS at the local hospitals, there's nothing else like it. They believe it's very worthy. Our scientific advisory board from doctors in Mount Sinai are saying, yes, we need this. And it's simple and straightforward, and it may seem like, well, they should know this. It could have been one day in their training, an hour in their training, and that reminder will push the needle forward.
And that's super important too.
I don't have a question, but I had a very different experience to the kind of classic aneurysm symptoms I think is important to share. So I had an aneurysm rupture in December 2021, and I didn't have the worst headache of my life. I didn't have the feeling of pressure or snap or cough sensations, any of those things on the pamphlet, but I had every classic stroke symptom, all the BFAST acronym. So, I was lucky that I got quick medical care, but I guess I comment this just to illustrate that an aneurysm rupture can also look like a traditional, an ischemic stroke, and not like these symptoms. So I think it's important to know those as well.
Agreed. Thank you. Great.
Yeah, so I just wanted to build off what Jaleesa said. And I think I just want to share a quick
my experience, and I don't know what it means for educating, but it'll give you an example and you'll know immediately. So my rupture occurred in June 2021. I was with my family, and it felt like a knife was stabbed in the back of my neck and up into my brain. Just the most excruciating headache of your life. To make a long story short, I got on the floor and I said, you need to call 911. I was vomiting. So we were on vacation in a small area in North Florida, and so the EMS came and they assessed me. And all I had really was a headache, a little vomiting. So they said, we think she has a migraine. And I think maybe what you want to do is to have her sit in bed and, try to sleep this off. And that my family said, no, she doesn't have migraines. You need to take her to the hospital. I would not have gone to the hospital. So they took me to the local hospital. And even in the ER department, my son and daughter were there and my husband. And the ER doctor even said, she's having a migraine. They treated me for migraine. And my husband had to push the CAT scan. And so he said, no, we're not leaving her until you have a CAT scan, until you give her a CAT scan. And so they did the CAT scan, and that's when she came in and said, you have an aneurysm that's ruptured. And within 10 minutes, I was on an air flight down to Advent Health in Orlando, and had a craniotomy and a double clipping in the hospital for 4 weeks. But I know there's pressures on the EMS, and I know there's pressures on the physicians. And I know most cases this probably is a migraine. I get that. But there's some of us that it's not. And we've got to do something with the education and health insurance and the pressure on the hospitals to treat us, and when they see those symptoms, not as a migraine, just in case, for the people like many of us in here had a similar situation to me.
Yeah, listen. Yeah. Thank you. One good point I want to mention is we speak to physicians, EMS providers, specifically emergency departments. The HA guidelines that came out in 2023 has inclusion of something called the audible rule. It's new in the algorithm, so it's 5 easy questions that is 100% inclusive, and they will then get diagnostic imaging if they, use the HA guidelines. And I think what you told me would be inclusive and yes to anyone with 5 questions, but that's directed right towards physicians, so it's not something I don't think we're prepared to start spreading to, the masses yet, but it is included as a Class 2B recommendation, which is a very, it's a strong recommendation.
Do you happen to know what those 5 questions are? I
I can get it to you.
No, that's okay. I was just
It's, I do, it's age,
I didn't put you on the spot.
it's age 40 and greater, let me get it for you. I don't know this.
Is it AHA guideline?
Yeah, the American Heart Association, if you just Google subarachnoid hemorrhage, AHA guidelines.
Okay.
Oh, I'm sorry.
I just want everyone in here who's had a rupture, raise their hand, who's actually ruptured. How many of you had 911? Who ran it up at 911 as well?
With all of the
If 911 came, how many of you were correctly diagnosed?
By 911.
By 911.
initially,
By 911.
like on the spots.
One person, 2 people. That's why EMS is so important to train, because I've heard this story. I've heard, oh, they're doing drugs. Mine was a migraine. They don't know. And we stand there as the lucky ones, but to me that was a great example of why it's so important for our grassroots effort to get into EMS. Just show you these are the signs and this is what's so important. This is what's going to save lives.
Thank you. Oh, we got a lot of hands.
So I had a similar situation to Leslie where 911 came, they took me to the ambulance, they said, you're probably just stressed. Went to the hospital, there was a neurologist on hand. They did not give me a scan. They told me to go home. I was stressed to take the Tylenol. I don't remember going home. I don't remember waking up the next day. Called my doctor, went into her office. She took one look at me and said, I'm sending you down for a CAT scan. And 10 minutes later, I was in the ambulance going to the hospital.
One full night with the aneurysm going on in my head.
Thank you.
Go ahead.
I want to mention something on the flip staffing. It's a little off topic here, but it's something that happened 6 months before I found out I had my aneurysm. I was in a rollover car accident. I lived in Moab, Utah, and I rolled my Forerunner on the backside of a mountain. I broke the windshield with my head, and I went to the hospital a long time to get there, and the emergency room couldn't get an IV in. So they did an MRI with no contrast and said everything was fine. So I'm only bringing that up because it's something that we've mentioned a few times, but if we don't have contrast, what I learned 6 months later when I had my stroke, where my aneurysm was found, they told me it wasn't found at that time, and they got the imaging because I didn't have contrast. And so that's something else that I try to share as well when I talk about my experience. I have head trauma in a short amount of time, but I didn't know that at the time. They just couldn't get the IV, and they kept trying and trying and trying, and finally they were just like, well, she seems to be okay, just do the MRI and it'll be fine. And they said, you're fine, go home. But I guess my point in saying that is that if you ever do go for an MRI, insist on getting contrast if you deal with head trauma. Just bringing that up. It's another kind of point of view that this was missed, and had I not had a stroke, it would have not been found. So I have an unruptured brain aneurysm that was found after my mild stroke.
Yes. Thank you. So, a few of you already know that I also had a subarachnoid brain hemorrhage, but just listening to what happened with you, I just want to share, mine was so different to yours. Mine happened during the night. I was with my family at home, and it was, I woke up with an excruciating pain that I could not understand what was going on, and it felt like a sledgehammer had hit through the back of my head, through my skull. And it was so bad, I was screaming, I was trying to wake my husband up. I was running around the room saying, there's something wrong, and I was telling him, please get up, there's something wrong with me, we need to take me to the hospital. I basically had a seizure and collapsed completely. My daughter actually got the ambulance for me, but she said that when the ambulance came...
While you were on the floor. So this bit she doesn't really remember. So the first bit she said, then my dad came into my room, and it was the middle of the night, and he woke me up, and he said something's happened with your mum, don't come quick. Ran into the room, and she was just passed out on the floor. And we didn't know what was going on, so we lifted her up, but she was just like, dead weight. We lifted her up onto the bed, and then she started foaming from the mouth. And then, we just had no idea what was going on. We didn't even think about what it was, the brain or anything. We just were in complete shock, and my dad was in so much shock, and I was like, we need to call an ambulance, and he just wasn't moving. So I just ran and grabbed the phone and called the ambulance straight away. And I think that one of the things was that ambulance did come really, really quickly. It was less than 10 minutes, which was amazing. But when I was just saying to my mum now that when they were asking questions, they really just didn't really know. They were just saying, does she have really high blood pressure? Does she drink a lot? Did you ask those questions? And I'm like, no, to everything. And all the immediate sort of things that you might associate with it happening. She didn't have any of those things, and she's super healthy, lived a really sort of good life. She barely drinks, she doesn't smoke, all these things, she's not overweight. There were so many things that they were asking us, and I was just like, no. But they just couldn't really work out what was happening, so then there just was, okay, we need to take her to into the ambulance.
But I was lucky, and I did have the correct brain scan, and I did get treatment, and I had 4 brain operations. But there was one thing that I just want to mention as well, is prior to me having that subarachnoid hemorrhage, 4 weeks, I had the most painful back, spine pain. And it was from my head all the way down my spine. I couldn't walk. I struggled. It was just awful. And it was like a sciatica pain. And I would need help getting out of the car, getting in the car, going somewhere. And it was on and off, intermittently. But I always felt that pain that I had was something that needed to brain hemorrhage.
Yeah, it's a sign your aneurysm might be leaking. I had that too. I had the sharp pain right above the eye.
So, I knew something was happening. I had a headache all day as well. And I just took 2 aspirins. And we were fine.
What's the next step?
So, 2 things. We started with asking, so federally, we're asking for additional money from the government for a project to do a best practices study and awareness education sessions like this across the country. And they've asked us to develop the program and to set some examples of how this could work. So this is an example. We've got 20 ambassadors in the room from all over the country, and the goal is to replicate this exact forum across the country. And what that will do is, right now, we're educating the suburbs of Philadelphia. In this room, we can educate the United Kingdom, St. Louis, Texas, Chicago, North Carolina, Virginia, New York City, South Carolina, Washington, D.C., Florida. So the goal is to replicate this. And this is pure grassroots at its best. And so we are currently writing grants. This is we started the foundation funding for preventative research. We're still doing that. The next step is developing best practices and developing these forums across the country to, there's so much stress in the medical system, but just opening up the conversation does so much. And right here, we have exactly this is being videotaped. We will use this now across the country. You have all now explained the hardest part about this. You've all had extremely different scenarios, right? There is no one scenario, but at the core of it, trust your instincts, call 911. That is often, we don't, as humans, want to do that. And
So just like anything, if you think of business, the government still comes back to us and says, you have to prove why we're going to give you money. When you go to NIH, they say you have to prove why we're being invested biomarkers that we're investing in. We were one of the first to invest in biomarkers. Why should we give you money? Why should we prove this? And that is what we're doing with earmarks. It happens. So it doesn't, we need hundreds of thousands of dollars in support to do this. And again, we talk about time to transport all the time, getting to the right center. But again, we've talked all day long, all day of having this retreat. Last night is the power of your voice. I talk about it all the time. Whether I'm talking, and never did, for those that don't know, I own a restaurant right down the street from here. Never did we know what that voice was going to become. People come in the restaurant, they come from all over to share their story. They'll walk in the door. My husband, who's on the line cooking, will then say, let me go grab my wife. And they tell the story. Every person that walks in our restaurant says, I know 1, 2, 3, 4 people that it has affected, my sister, my brother, my spouse, somebody. The statistics are radically off that we have. But the power of your voice, whether you're talking to we are on the Hill. Erin comes as much as she possibly can from about March until October, November. I'm on the Hill every single month, 3 to 5 days out of the month, advocating. If you do not tell your story, if you do not advocate on the Hill, whether it's about aneurysms or whether it's about credit card processing, anything, you are never going to be heard. So it's something that, again, just talking, our ask to you is just to talk about our story, and is like many, many stories. Thousands and tens of thousands of stories that they had no idea what was going on because they didn't have the training. And Erin and I said, we worked, like she said, with HHS and CDC. CDC didn't even have a definition of brain aneurysms and what it is. We're now writing that. In Congress, we're writing with HHS, what are the best practices? And we sit with NINS, which is the Neurological Institute at NIH.
And Dr. Korashevs, who's the director there, we have a wonderful relationship with, and he's sitting next to me saying, well, they all know. And I said, it's just like if you're learning something in marketing in college, you're not gonna remember every single detail. And that's something that's so important, that to just spread the word, like Matt said. We always go top down, but we have to go bottom up with this. And it takes everybody, I've said, everybody in the room here today, you don't realize what your voice is. You don't realize when you're having a cup of coffee, you're sitting, and we talk about it all the time. My husband, my brother-in-law, they talk about it nonstop. You don't know who has been affected by it. So whether you're in the airport, we'll have something on that says something about the aneurysm, and it's very weird how all these things happen, that we come upon people, but you just don't know who has been affected, and it's amazing where.
It's not just EMS, I mean, we've got PTs in the room, they're talking to their patients, we have family practice, PCPs, like, and so it's just talking about it, the disease that doesn't get talked about, because it's scary. And so it's opening up that awareness. Good question.
Question. So, I mean, granted, I think it's mostly women in the room, but is this more of a woman thing, or is it just
1.5 times more likely to affect women's, 1.8 times women, 1.8 times more likely to affect Blacks and Latinos. So yes.
you have data?
We do. Well, but also, women are more likely to come to support groups to share their experience, and so it's, breaking that barrier down.
They'll complain, they'll go into the hospital, they'll talk about what's going on. They'll also get dismissed very easily of saying, must be the kids, you're stressed, you're overwhelmed.
It's anxiety.
Yeah.
What were you going to say?
Yes.
Yeah, so my name is Minda Thurman. I had my ABM and aneurysm rupture in February 2020. And something that they pointed out is that this disproportionately affects not just women, but women of color. And to be honest, I was in a situation where, I was dismissed. It was taken as, oh, you're just exaggerating, or you're being dramatic, or whatever that label that comes with what looks like me is in society. That was applied to the type of care that I was receiving. Thankfully, I actually, they do check your insurance, which is crazy because they'll check that first before they even treat you. But I'm a United States Air Force veteran. And so, thankfully for me, my situation was covered, but there are so many people out there who look like me, who don't get the help and aren't taken seriously at that ground level when they get to the hospital. And yes, the first thing that they'll ask is it a migraine? Is she being dramatic? And, all of these things. And then it's simply, when you realize you can take a picture, and I had insurance. So for me, it's a very scary thought that your life hangs in the balance because someone didn't ask these questions, take a picture, go through everything that's on this card, these simple things, asking the questions, all of these things. It can mimic this, but can we take a picture? And so with all of the technology that's out there now, I'm so grateful that there are ways that we can see this on a screen, without having to, jump through all of the hoops, but it's still something that needs to be pushed. It needs to be, your voice needs to be heard. If you're in spaces that, people will listen to you talk about this, because you can save lives. So I just wanted to make that point.
And I'll just close by saying thank you very much for allowing me the time to talk a little bit and to hear your stories. It's so extremely important to me. So important so that I try to attend the support groups when I can, because I learn and I take that back to the patients that we serve. And thank you, Tracy, again, for sharing. I will say you never know who you're going to talk to. When I met the B Foundation about 6 years ago, I didn't have the position that I have now. And so right now, I conduct mandatory education for all nurses across the system when they're new. And I capture them. And we talk about brain aneurysms. And from some EMS providers here in the room, we're extremely close and communicate so that we follow up in the community. And I'm able to provide them with the CAT scans to show them when their diagnosis is correct. We can talk about which ones are bleeds and the mimics that other patients may come in with. So it's a listening experience. So you never know exactly who you're going to be able to capture and talk to. So if it wasn't for you guys, we wouldn't be talking about the folks right now. So thank you.
Thank Tracy for her courage, and I cannot thank Matt enough for your support of the foundation. And I think the ask would be for y'all to try and find a Matt in your area that can help bring this back to your regions and spread the word. So thank you, Matt, for all you do.
Yeah, I think that my ask, as Erin was, to have the voice. Don't be afraid to use your voice. Your voice is incredibly powerful. And again, we strive to make this not a scary thing. It doesn't have to end the way that it did for us and for a lot of other people. So I think to have that, to be out in the community, to be talking about it, that we want to change the narrative in the country.
Across the board, this is not just about brain aneurysms. It's about advocating for your own health. And we have to do that in this country, and we have to, prevent, take care of our families. So thank you all for being here and talking about this.